far, apart from the weather today, which started off looking quite nice, and then it started raining and pouring, and a bit of a mixed weather today, really, to be honest. So I'm hoping everybody's enjoying Ramadan. We're almost a third, well, we are a third of the way there now, inshallah. So it's going very, very fast for me. So please let me know how you're feeling and how you're doing today. The telephone number for the studio is 0116 482 2086. You're listening to Radio Ramadan on 87.7 FM, or you can WhatsApp us on a message, and our telephone number is 0774 8855 055. You're listening to Radio Ramadan on 87.7 FM. I'm your host, Zuffar Haq. We're talking about health and well-being. Health and well-being. How are you feeling today? And we'll be talking about high blood pressure. So if you suffer from high blood pressure, or you know anybody who suffers from high blood pressure, please listen in, or give them a call, send them a message to listen in. We'll be talking about high blood pressure and how you deal with it. It's hypertension. We'll be talking about diabetes and how to deal with diabetes. And also we'll be talking about cancer. Cancer is always a horrible word when even it gets mentioned, but we are going to be talking about cancer and screening tests and what we can do to try and avoid cancer. And we'll be having Dr. Raj Tan, who will be joining me shortly, talking about these subjects. But if you've got any questions in advance, please give us a call on 0116 4822086, or you can send us a WhatsApp message on 077 488 55055. So last week we were talking about COVID. So also, if there's any questions on COVID, we're more than happy to answer those questions. Dr. Tan will be able to answer your questions on COVID-19 as well. If you've had the vaccination, if you need a vaccination, where you can go. But you can also look on the website for NHS Leicester if you need to find out where you can get your jab from or where you can get your vaccinations from. You can look on NHS Leicester webpage, and you'll be able to access lots of different information about various different diseases on there, as well as your COVID vaccination. You're listening to Radio Ramadan on 87.7 FM. I'm just waiting for our guest, who is Dr. Raj Tan, to join us very shortly, and hopefully we will be able to answer some of the questions that you might have relating to high blood pressure and diabetes, as well as looking at any other issues that you might have. He's a local GP in the Leicestershire area, who will be joining me shortly. If there is any questions, you can always give us a call or send us a message. If there is any other questions that you would like to ask your GP, or you have any other issues relating to the NHS, you could always send us a message on our WhatsApp message. But also, if you have any problems in the future, over the next year or 2 years, you can always drop me a message directly, because I do have quite a bit of involvement in the NHS. And my telephone, my direct line number is 0781 710 7022. And I'll repeat the number again, 0781 710 7022. And you can message me anytime if you've got any issues relating to the NHS that you would like me to take up for you and try and help you with. You're listening to Radio Ramadan on 87.7 FM. My name is Zuffar Haq, and you're joining us in the Health and Wellbeing Show, which we will get underway very, very shortly. And we'll be talking about hypertension, diabetes, high blood pressure, and how we can deal with these issues. If you have any of these issues and you want to ring in, please feel free to do so. We'll be talking about high blood pressure, diabetes, and any other questions that you might have for a GP. The telephone number for the studio is 0116 482 2086, or the WhatsApp message number is 077 48 855 055. We're joined by Dr. Raj Tan. Good evening to you, Raj. How's it going?
Thank you. Thanks so much. Yes. I think okay, and nice to be here.
Thank you very much for joining us again this week. I know you were on last week as well, talking about COVID-19 and how people should be vaccinated and how many patients are. We were talking to Richard Mitchell, the chief exec of the hospitals, over 200 patients in hospital at the moment with COVID. So COVID's not gone away, has it?
No, it's definitely not gone away. In fact, we are seeing these cases So
Yeah.
that's like
Yeah.
directly
Okay.
related. Yes.
So we're talking about high blood pressure. So can I start by asking you, Raj, what is high blood pressure and what are the symptoms and what should we be looking out for?
Yes, so high blood pressure is it's a kind of like a bit of a misnomer in one way as well. To how do we understand this? Yeah, and normally we get high blood pressure when we get stressed and anxious and all those things as well. But they are transient and they just go away itself. Yeah, when you get relaxed and things. So the thing that we are thinking as a disease as a high blood pressure is that the one that which stays on persistently high. Yeah, in the with some variation in between, but average readings are always high. Yeah, and then if you got that kind of problem, which can be sometimes a bit of genetic, a bit of like because of your own lifestyle, and because of inactivity, diet, yeah, and the body weight, all affects those to get those high blood pressure. And then there are other conditions sometimes affects to get high blood pressure, like kidney diseases and other diseases that are related to the endocrine organs. Yeah. But most of the blood pressure that we see day in, day out are most is lifestyle issues and some genetic issues.
So when you talk about lifestyle issues, look, I have high blood pressure.
Yeah.
It's rushing around too much,
Yeah.
taking too much pressure on, working, too hard probably, not taking time out to relax, and maybe eating not the right kind of food as well.
Yeah, all these combinations of everything, because chronic stress can also makes your effect on your body organs. Yeah, and then that causes the blood pressure to be raised permanently sometimes. Yeah.
So if you have issues relating to blood pressure, please give us a call on 0116 4822 Do you have symptoms or do you have something that you're not too sure about? We've got Dr. Raj Tan here, who's a GP, who might be able to help. Or you can send us a WhatsApp message on 077 488 55055. If you've got a remedy, if you've got some super fruit or super sort of cure that you're using and you think actually it works really well on blood pressure, then let us know, please. You've got the telephone numbers or you can message us. Dr. Tan, how would you deal with people who have high blood pressure? What can they do to reduce their blood pressure?
First of all, it's like depend on what level you got high blood pressure. Yeah, if you got like just over the limit, supposing like for most patients who are not diabetic, we would say the limit of the blood pressure is 140/90. Yeah, if you got above 140/90 persistently high, then your GP will like to know that, and then they will like to diagnose blood pressure. They will like to do some blood tests to make sure the kidneys are all right. Urine tests to see that urine is all right, and then some blood tests as well to make sure that there are no other causes for high blood pressure. Once they've confirmed that, then that the first step is like any other like a lot of chronic diseases, is about lifestyle. Yeah, and
exercise and the normal sort of things.
Yeah, when we say exercise, it's more of something that can make you a bit puffy and sweaty for half an hour a day, like at least 4 days a week. Yeah, would be to make the blood vessel relax. And if the blood vessel relax, the blood pressure falls. Yeah.
So actually, you don't necessarily need to go to the gym. You could just walk up Hartington Hill or St Saviour's Road, walk up the hill for 20 minutes, as long as it makes you breathe heavily, effectively, isn't it?
Yeah, so something that will make you a little bit more, a bit not very strenuous, but yes, has to be feel like it that you've done the exercise, and then and also the main important thing here is to be regular on that, because the body remembers, has got the body clock in there. If the body remembers that condition reflex, let's call it, then the blood vessels relax as part of doing exercise, and that is what we want, the blood vessel to relax, and then the blood pressure falls.
So exercise is really good for you. It doesn't necessarily have to be running, does it? It doesn't have to be in the gym either.
No, definitely not.
So you could go a walk around the park, Spinney Hill Park or Victoria Park, or whichever park is nearby you.
Yes.
Or walk around your block, the street block, and just do that once a day at least 4 times a week.
That's right. Yeah. Yep. And the regular is more important than anything else. You have to be regular. And then the other thing is the reduced salt intake. Yeah, the salt.
Well, unfortunately, all our food, Raj, all the curries, all the salad, all those things that we have, all the things that we love, all have salt in them.
that's very true, and then there's some part like salt makes the food tastier, so
Yes.
that's another issue. But reduced salt is as effective as taking a tablet for blood pressure.
Wow,
Yeah.
wow, right.
So reducing salt is really important in blood pressure problem, and also the other line is the as we all know in the blood pressure is about if you got the medications, and there's a myth about blood pressure medication that people take it when they get headache. Yeah, that means that they take the medication, but if they not got any headache, they won't take it. But blood pressure medication only works if you take it every day.
Okay, so you've got to just effectively take it every day.
That's right.
Yeah,
That's right.
and you know, you talked about salt. Sometimes in the supermarkets, you get something that says low salt.
Yep.
Yeah, in a sort of white or blue thing. Does that make a difference? So it's half the salt, or is that? And does it taste the same? Do you know? You might use it at home.
Yes, low salt preparation are definitely helpful. Than definitely like high content salt. But the only problem in the other thing is, although some of the labeled foods like may not taste salty, but if it's especially if the microwave ones and things like that.
Anything processed, you mean?
Yes, that's
They
right.
have salt in them.
They have salt in them to preserve it. Yeah.
Yeah,
So that means they might not taste salty, but they got quite high content of salt in it.
Yeah, but Raj, lots of food nowadays has longer dates. I've noticed lots of food have got longer dates, so that the supermarkets can have them there longer, and they don't perish. Yeah. But actually, what we're doing is we're increasing the salt levels in those foods, and it's damaging our body.
Yeah. So these days they have to put those markers of like red, amber, green levels. So when you look at the salt and then they put it as red, that's perfect. Definitely something you never should have. Yeah. And you go for the green if you can. If you can't, at least an amber.
Yeah, I normally don't look at the salt level. I normally look for the sugar level. But we should be looking for both of those two levels. That's really important, effectively. So on that traffic light that they call it on the foods, we should be looking at both the salt levels and the sugar levels.
Yes.
No, that's really useful. And you know, there's also a Himalayan salt.
Yeah.
Is that better for you or not?
Well,
it's supposed to be.
Yes, it's supposed to be that it has got the it should make it not like harmful effects. So the main thing that the salt does is it attracts water into the blood and makes the blood volume bigger, and that's why the blood pressure goes up. Yeah.
Okay.
So hopefully they are claiming that actually that will be less effect in that way, but I haven't
seen the
evidence based that way. Yeah.
If you're using any ideas to try and reduce your salt levels, please give us a call or reduce your blood pressure. Telephone number is 0116 4822 or you can send us a message on 077 488 55055. You know, we're talking about blood pressure. So the obvious cure for that is if you don't do it sort of by reducing your salt and exercising and all those other things, is by having a tablet, having medication from your GP.
Yeah.
And how easy is that? And is there any side effects to the medication as well?
So blood pressure, although it is really a dangerous disease, if it's not treated, because it can cause strokes and heart diseases and kidney failures. So, but good news is it's easily treatable and controllable. Okay. So with lifestyle, diet, of course, and then plus the medication if required. Yeah. So like I said, the medication, there are various medication depending on your age and depending on the ethnicity and things as well. That medication can differ.
Are we at higher risk because of we're from India, Pakistan, subcontinent?
No,
is there risk higher from
the blood pressure? We haven't found that kind of ethnicity difference in that way, but in the treatment it differs because of how it acts on the kidneys.
Okay.
But in the prevalence or in the risk factors, unlike diabetes, we haven't found that much of like the significant difference in that way. Yeah.
And so it's pretty easy to treat. Is there any side effects from the medication?
Yes, I have to say that there are no medication without side effects, and the medication that works always will have side effects. But most of the side effects are well tested and tolerable, and they don't cause risk problem like risky issues.
Okay. Yeah. Okay. And the risk is if you have high blood pressure, you were saying, can damage your kidney. What are the real big problems that high blood pressure can cause your body if it goes undetected?
If it's go undetected, the first thing is like it can cause brain hemorrhage, causing stroke, which is a fatal. Sometimes it could kill you, and if it doesn't kill you, even it can leave you like vegetated, paralyzed, which is a big disaster. So that's the main big thing that we want to prevent. And the other thing is because it causes, when you've got high blood pressure, the heart has to work harder to pump the blood. So that means the heart can fail. And then that's another issue that you get. And then the third one, the same thing, the kidney has to work harder as well when you have high blood pressure, and then the kidney can fail.
So it's very, very serious
issues.
Very serious issues.
Yes.
And also, as a GP, do you try and look out for all of these signs from your patients, especially when they're in their 40s and their 50s? Is that what you try and do? Try and look for those patients that have got high blood pressure so you can treat them before they have these major problems?
Yes. So at 40, we have an NHS health check for everyone, which includes checking for blood sugars, cholesterol levels, and blood pressure. Those three things are the main thing that we want to look out for at the NHS health check at 40. But we are seeing patients developing before 40 for high blood pressures. So especially because of lifestyle, body weights, and genetic issues. So that's why we want people to come forward with the sometimes even the self-monitoring with the home blood pressure monitors, and then and it's not only the GPs who can check your blood pressure. You can get it checked at the chemist. You can get it checked.
And they'll do it free of charge. Any chemist will do it free of charge. Which is really useful to know, because if you are worried about blood pressure, the chemist can do it for you. You can check your blood pressure, make sure that it's within the limits. And if it's not in its limits, you can get referred to the GP and try and be looked after. But if you wanted to try and do something about it yourself, exercise is the key. Walking 4 times or 5 times a week, half a mile, quarter of a mile, just to keep your body active and making sure that you push yourself as much as you can within reason, so that you do get tired, and that way you can tell that your heart has been pumped effectively.
Very true. Yes, that's right.
Okay. So, if you've got any questions on high blood pressure, give us a call on 0116 4822 or you can send us a text message on 0774 8855 You're listening to Radio Ramadan on 87.7 FM. I'm your host, Zuffar Haq, and we've got Dr. Raj Tan here. Dr. Tan, I also wanted to ask you, we talked about sugar, salt and sugar being in the thing. Is anything particularly good as a superfruit or super sort of medication that is really active, natural thing that you could use against blood pressure?
That's a difficult one for me to answer. Actually, there are some. I know that there's quite anecdotal, and also some traditional way of people think medications are. But the most important thing here is to mainly that we need to detect blood pressure at the right time. That's quite important. And then the other thing is, if you know that you got high blood pressure, you have to do something with your lifestyle, diet, and then don't delay the medication though. There's no harm in perhaps taking them what you believe in it as well, but don't delay the actual medication, which has got good evidence to make sure that your blood pressure actually is controlled. Well,
we've got a message coming in. Thank you. Assalamu alaikum. Salam's just an inquiry for the doctor. My mum has a migraine every day and the GP keeps providing medication, but none of these have worked. Could this be chronic migraines, or is there another solution for this? What do you think?
Yeah, it's a migraine. I think as well. It's sometimes what we call it. There are some of the migraines are more of a very typical textbook pattern, comes on one side, and it brings about by stress or flickering lights and the certain diets and things. And
she did say she's been referred to a neurologist for treatment to check. So she's obviously been referred to the hospitals then, hasn't she? She was referred to a neurologist, but they said to wait a few months before seeing her. That's that's a big major problem at the moment across the board. Anything you could suggest? Go back to the GP and maybe try something else, or
Yeah, if it's a kind of a headache of exclusion as well. Yeah, and if the migraine tablets are not working, that the migraine has got two type of treatments. One is like the one that you take it when it comes on, or
Yes.
just after just coming
Yeah.
on, and then if it's a frequently coming on, then they can give you something to prevent it from
Prevent
coming
it
on.
going.
Yeah.
Okay.
So it's a balance of those two, and also looking out for triggers. What triggering you, and then what triggering the migraines, actually preventing those triggers can be really helpful as well.
Exactly. Yeah. Okay. We were talking about superfruits. I just googled on the internet. The list of superfruits are blueberries are very high on the list. Kiwi comes up there.
Yeah.
Pomegranate, avocado. Avocado is there. Apple, cherries, strawberry, cranberry,
Yeah.
berries. Most of the berries go down, and then grape, etc. Mango's there on the list as well. So lots of great sort of fruit. You know, during Ramadan, I know that Akil and many others, probably we all indulge in the few too many samosas and bhajiyas and everything else, which is obviously not very good for us at all.
Yeah.
And I'm trying, and I don't know whether the listeners are out there, I'm certainly trying this year to try and have a bit more fruit
Yeah.
with my food rather than having anything fried.
Yeah.
And try and avoid some of the fried samosas. And even though they are absolutely fantastically lovely,
Yeah.
my wife, I've got to say on radio that she cooks very, very nice food. But superfruits and actually going out my way to have fruit during Ramadan, how much of a difference does it make about what you eat when it comes to these kind of diseases?
Yeah, I do sometimes things that you get what you eat. To be honest, yeah, the body is like how you get is what about your diet is very important.
Yeah.
And 5 a day is got a very good evidence. Yeah, that's why we call it 5 a day for the fruits. Yeah, and the 5 portions of fruit a day is important part of the diet to keep the health and well-being. Yeah, to get all the vitamins that needed for the body.
For the body.
Yeah, without having needing to be any other vitamin supplements.
Okay. So it's really about superfruits and the greens, as they used to say. So vegetables. But you know, Dr. Tan, we're living in a world that is now there's a credit crunch on effectively.
Yeah.
Inflation is there. People are struggling out there to provide, fresh fruit and veg isn't cheap.
Nope. Yeah. But what you could say is like it is about balanced diet. Yeah, it's about balanced diet. So in a day, there are fruits like some of the bananas, daily bananas, like and apples.
Yeah.
And
They're fairly reasonably priced.
Fairly reasonably priced. Yeah. And they are natural. They are local products. Yeah.
Yeah.
So that kind of things are actually quite good as well. In the potion that 5 a day potion, they can be quite well included in that.
I mean things like coriander and spinach and all those things that are grown in the country, cucumbers, lots of other things. They are still very good for you, aren't they?
Yes, they are. Yeah, extremely like the greens and the fruits. I think you can't go wrong with it.
You can't go wrong with it. Okay.
Yeah.
Okay. No, that's good. That's good to know. And we're going to touch on diabetes now. One of the things with diabetes is obviously sugar. So how does diabetes occurs, and what should people be looking out for?
As we all know, like with diabetes, the main type of diabetes is type 1 and type 2. Yeah, and although there are other types, we won't talk about that today. And the type 1 is more like a genetic, and you get it from birth mostly, or you get it in your childhood, and sometimes you can get it in a teenage as well. And it's like we can see it in later age as well, which is a bit rare. But the type 2 is what we're talking about here, which is about multifactorial, but a lot to do with your lifestyle. Yeah, and another lifestyle.
You're listening to Radio Ramadan on 87.7 FM. Our telephone number is 0116 4822 or you can send us a WhatsApp message on 077 488 55055. I'm sure there's lots of people out there who struggle with diabetes. Everybody is at risk, I think, in some way, shape or form from the Asian community from diabetes. Please send us a message. Please tell us how you're dealing with your diabetes, or if there's any ideas you've got or you're worried about something, please let us know and we might be able to help put your mind at rest. Dr. Tan, diabetes is a huge problem and a huge killer within the Asian community, isn't it?
Yes, type 2 diabetes is no doubt we have a highest prevalence among our ethnic minority population. And in a city like Leicester, the prevalence in the city is like I was told that's about 13 to 14%.
Yeah,
which
and it's
is-
massive.
which is like
And if you
massive,
take away the sort of population that isn't from Asia,
Yeah.
it's probably higher than that in the Asian community, isn't it?
Yes, that's right. Yeah.
Yeah. And it, what would you say? Is it a killer?
Yes, and again, like a blood pressure, if it's not detected and not controlled, yeah, it is a killer.
It is a killer.
Yeah, no doubt about it. And it affects even wider in the body than the high blood pressure. Yeah, in that way. So it causes from head to toe, like it causes the number one causes of blindness, yeah, and then causes of the ischemic heart disease and heart attacks, yeah. It can cause the strokes as well. It can cause kidney failures. Can make your legs so that blood flows along the legs like get poor. You get leg ulcers and foot diseases and amputations. Yeah, so
I don't know. And I've heard that amputations are taking place in Leicester as well, aren't they?
yes, yeah, and we have unfortunately amputation rates are not being in the level that we want it to be, low
There's
level
quite a
we
few,
want it to
isn't
be.
there?
In that way, that's right.
Numbers are going
Yes.
up.
Yeah.
Yeah. It's really sad when you hear that, because you would have thought that in this day and age, with technology and the latest medications, that diabetes would be solved in some direction. But obviously lifestyles are there. Lots of different things are factors in this, aren't there?
Yes, and in foot disease, unfortunately, as you can see in the lockdowns, when the lockdown, that's one of the disadvantages of the remote consultations and things, and the people who are not able to go into the clinics and things. The foot check has been an issue, and we have seen that the number of foot checks has actually reduced and gone down in the last lockdown period, and there's some backlogs of foot checks. So we are actually urging people who have diabetes and who hasn't got their feet checked within the last 1 year, needs to contact the doctors, to make sure that they get arranged for the foot checks.
So let's get this message clear. So anybody out there who's got diabetes, who's not had their foot checked
in the last
12 months, to proactively contact their GP, get it checked by their GP, just to keep an eye on their foot, because the amputation levels are going up in Leicester.
Yes. So in the practices, there'll be healthcare assistant, and there'll be podiatrists, there'll be different multi-professionals who can do the full check for you. Once you get, and the nurses and the diabetes nurses can help you as well to the reception. You can get an appointment directly with them without needing to go to GP, and if you have to wait for GP appointment. So that's quite important. And also the other important thing is to look after your feet. It's very important. So Diabetes UK has got a very good instructions on and advice on their website. About
so that's if you want to Google Diabetes UK on their website, there's plenty of advice how to care for your feet to make sure that actually you look after them and that you don't end up having any of your toes or anything amputated.
That's right.
Great. Dr. Tan, you were talking about face-to-face and seeing patients. How many patients do you see face-to-face, and do you see them remotely now, or are you back face-to-face now?
We are doing face-to-face, and we have a remote triage for most of our patients. But after that, if that patient need to be seen on that day, then we call them in the afternoon for face-to-face, or next day appointments for face-to-face appointments for examinations.
Yeah, I mean, lots of people still say, "Oh, we can't get to see our GP. We're struggling. We have not had access." But the appointments are being freed up, and they are being seen now. Patients are being seen face to face.
Yes, if you have a clinical need for seeing face to face an examination, you should be seen face to face.
Yeah, and you can actually say that to the receptionist and say, "Look, I think I need to be seen face to face. Can I have a face to face appointment?" And I think they normally do facilitate that.
Yeah. So the important thing here is also you give when the reception asks for certain information on the phone. I think sometimes we feel like it is our privacy and we not to tell, but actually these modern days that actually helps us in to which doctor and which mode of consultation is required for what kind of problems. Yeah. So if that information sometimes is it is useful these days.
Yeah, but patients do get offended. They think, well, we're talking to the receptionist, we're not talking to the doctor.
Yeah.
Why do we have to discuss this?
Yeah.
But if you're saying that actually it helps the GP to give an idea which category of care they actually require.
Yeah, because these days, sometimes that in the practice we got multi-professionals now working. Yeah, and all has got different skill sets. Yeah, in that way. So we only can divide that into which skill set need to be seen for which patients, and then only when we know the problem. So that can be quite useful, like to have that, and so that you don't have to be waiting for another appointment because you went to the wrong person in the first place. Yeah.
Yeah.
So it actually helps.
It helps and streamlines it and makes it quicker. You're listening to Dr. Tan and Zuffar Haq. We're your hosts on the Health and Wellbeing Show. Our telephone number is 0116 4822 or you can send us a text message on 077 488 55055. Dr. Tan, we discussed diabetes and how really deadly an illness it is, and it's actually a lot more serious than high blood pressure and lots of other things, and how badly it affects our communities. What is the sort of medication that somebody can take, and how is it controllable?
First of all, is like to know whether you got diabetes or not. Yeah, that's an important thing.
Diagnosis. Yeah.
Diagnosis is a very, very important thing. And as I said, the lifestyle and the body weight and the diet, genetics, all plays a role in developing type 2 diabetes. Yeah. And like high blood pressure, unfortunately, you don't get symptoms. Yeah. And so you can only picked up by the one that are picked up by symptoms are usually the one that are quite bad already.
So it's too late by then.
Yeah. So it's like it'd be risky to leave it till that stage. Yeah. So that's why you should be get screened for the diabetes, and that's again you can do that without going to the doctors these days now.
So you can go to your nurse and say, "Can you screen me for diabetes, please?"
Yeah, and there is a called Know Your Risk Score, which is again sponsored by Diabetes UK, and you can go to the website and do that. The Know Your Risk Score, and then they will do the calculation, and they have asked you for some information about your body weight and ethnicity and the genetics and then things, and based on that, they will give you red, amber, green, and what risks you are, and then that can then lead you to either you can go to what we call it prevention programs, like with the National Diabetes Prevention Program, one of the largest program in the world that we have now in the UK. Yeah, and that is that's actually shown the result have already come out now with the trials that it's actually shown that it can really postpone the developing of diabetes if you get it early on that. Yeah. That way as well. So.
Would you say that most of the Asian community are at risk? We're all at risk almost.
Yes, then one of my professors will say that in the Asian community, either people who are already diabetic or there are people who will become diabetic later.
Yeah. So it's better to avoid early on. And how can you avoid getting diabetes? Is it stopping eating sugar or reducing the sugar intake? What can you do to prolong your onset of diabetes? Because diabetes is not very good, is it?
No, not at all, actually. So lifestyle. Yeah, again, it comes to that, actually. And lifestyle includes, again, two things, diet. And in the diet, I will call it direct and indirect sugars. So direct sugars are the ones that are proper sugar ones. Yeah. The snacks and the Indian laddus and Indian sweets and
that we all love,
things,
that we can't eat.
Cakes and all those things. Those are call it a proper direct sugars. Yeah. Those are probably no and no.
Akil, are you listening?
Yeah. And the indirect sugars are the ones that are more become sugar in our body.
Yes.
Which is like a white rice, white breads. Yeah.
So they've got sugar.
Pizzas. Yeah, they become sugar in our body.
Right.
Yeah, so that should be reduced amount as well.
Yeah.
The brown stuffs are better because they also become sugar, but they become sugar in a controlled rate. Yeah, so the body can absorb it.
So that's why people like brown bread, brown rice.
Right.
So the more brown the rice, the better off you are.
Yeah, that makes your body to absorb sugar slowly. Yeah, so that doesn't go in the bloodstream to become high sugars in the blood.
Is that the same with bread?
Same with the brown bread as well. Yeah, so that's why the white all these made up of naans and the maida as we call it, isn't it?
Yeah.
All those stuff will be quite bad they are indirect sugars. Yeah, they become sugar in the body.
Yeah. And it's always strange because they're always cheaper as well, aren't they?
Yes. That's right. Yeah, and they're tastier as well.
They're tasty as well, but you've got to control that level of a balance.
Yes, that's right.
So wholemeal atta
Yeah.
and wholemeal sort of chapatis rather than actually the white and everything else.
Yeah. The brown rice, yes.
Yeah. And, we're on Evington Road. We're broadcasting live from Evington Road today. Lots of sweet shops, lots of dessert parlours, lots of that kind of thing. Is that okay or not really, or is it occasionally, or what?
It is. I would say it is. It is one of the things. It's to be honest, I felt quite worried and concerned to see a lot of restaurants being converted into dessert shops in our city. Yeah.
So
which
you
is
actually worry about that?
Yes, that's right. Yeah.
Because you think to yourself, more patients coming my way, more people at risk, more people could die.
Yes. Yeah. That kind of sugar diet is actually not good for anyone, especially in our community and the ethnic minorities who are already on high risk and the metabolically. So I think it is something that we have to make sure that we can moderate it, and then we'll look after our diet and lifestyle in a balanced way to get away or to not to develop these kind of diseases. Yeah.
Or even if you sort of have it once a week, once every 2 weeks, probably get away with it then.
Yeah, everything in moderation.
Moderation,
is
it's
a
not
good
like
way.
you go every
That's
day
right.
to have a waffle
That's
or
right.
whatever it might
Yeah.
be, because that would be ridiculous, wouldn't it?
Right.
Yeah, yeah. And how big a risk is too much sugar to your body?
So sugar is like I think it's mainly for the like taste buds.
Yeah.
But in the body, what the amount of sugar needed for the body is quite minimal. Yeah. And especially if you're not on any drug that will lower the sugar. So I would say that reducing sugar is as important as reducing salt as well. Yeah. Those two are the things
Dr.
that-
Tan, it looks like you will have us eating nothing both ways. No salt, no curries, no sweet dishes. What we're going to be left with? All we'll have is the fruit. But, there has to be moderation, isn't there?
That's right. Yeah. So moderation is a key. Yeah, and the lifestyle. And if you're eating your sugar, like you are burning them. Yeah, by doing some exercise, regular exercise, walking. And then some people, like a lot of patients, ask me like, "Oh, my work is like intensive." Yeah, and then that will be okay. I don't need to work out. That the problem here is about the muscle memory, we call it. Yeah, and then also like something like we call it more like your metabolic clock and those things. So it's about regular pattern of exercise, and we call it aerobic exercise, not weightlifting exercise. Yeah. Aerobic exercises are the important factors of our life. Yeah. And as you know, society has changed that we want to park the car in front of the shop that we want to go in, yeah, rather than walking down and then parking the car a bit further away. Yeah. So that kind of like behavior changes are quite important. Yeah, if we're along with what diet that we're doing, and then as you know that our diet are becoming more rich in sugar, more rich in salt. Yeah. So along with that, behavior changes are also like becoming less exercise and less activity. That combination of these things has caused the surge in those diseases like diabetes and hypertension.
Yeah. I mean, so you're basically saying exercise where you can, park your car further, walk.
Yeah.
The more exercise you can possibly do, doesn't have to be running, doesn't have to be strenuous exercise, but just being active is really crucial to keeping both elements of blood pressure away as well as diabetes and keeping you fit and healthy.
Yeah.
Both and your mind as well, isn't it? It's not just your physical body.
No, there's very good evidence that actually doing physical activities excretes the endorphins, the happy hormones from the brain, which makes you feel well, happy, and in a good well-being. Actually, so it's actually I think it's a one stone with multiple birds.
Yes. Okay, and fruit. We're in Ramadan here, and actually, what happens is most people, I'm guilty of it as well. We'll have our curries, we'll have our samosas and bhajiyas and everything else, and we'll have our curries and rotis and then we'll have some kind of sweet dishes and everything else. So that really is a bit out of the window with the Dr. Tan diet, isn't it? Really?
Yeah, I think it is one of those things that you just have to like in the balanced diet. We found it like when we call it balanced diet, sometimes like it's not only about. I call it in the diet. The three things are important. One is about portion. Yeah, it's important that you have to have right portion for your. You cannot store unlike a lot of animals and things like that. In that way, human cannot store the food as such.
Yeah.
So we can only eat what we can eat, unfortunately. Overeating doesn't mean that we'll not get hungry later. It's not that way.
Yeah.
It doesn't work that way. So, and then that's an issue. And the portion is important. Another thing is content, as we say.
Yeah.
And it's 5 a day, and having more like fruits, vegetables, and lean meat if possible. Yeah, in that way.
And lentils, because I know my father, he was a vegetarian, he didn't eat meat, but he loved all his dals. He would eat, and he was fit until he was 90, into his 90s.
Yeah, it's very good combination of a lot of proteins and a lot of vitamins. Yeah, so it's a very good diet. Yeah, it's a staple food actually. It's one of the staple food, and it's a very good diet overall. So portion, content, and then there's a timing.
Yeah.
Yeah, so
we've got a message coming in. If you had a thyroidoxomy, how do you control in addition to thyroxine, and what would the body need, Dr. Tan?
Yes,
that's from May Kazi. May, we will try and answer your question, Dr. Tan.
So thyroidectomy is that means your gland that producing thyroid is removed. So no doubt that you need a lifelong thyroxine replacement. Yeah. So as long as you're getting the right dose of thyroxine, you shouldn't need any other adjustments doing into your life. Yeah. It's like you're replacing something that should have been in the body, which is not there now.
Yeah.
So the only trouble is that can be up and down in the replacement levels.
Yeah.
So that need to be checked regularly that you're getting the adequate replacement.
Okay.
Yeah. And as long as that replacement is right, then you shouldn't have a problem.
You shouldn't have a problem. Okay, another quick question about high blood pressure. What could you do to mediate it in such a young age, if you get it at a young age?
Yes, if you got a young age, the first thing I would like to make sure that it's not because of any other condition that's causing the high blood pressure. Yeah, so like kidney diseases or other endocrine diseases, like we call it adrenal glands, like Cushing's and that kind of things. Yeah, so that your GP will need to look into that, and to rule out those conditions that is not causing the high blood pressure.
And what could you do if you didn't have any of those issues? How could you cure it then, or could you improve it?
Yeah, it's actually good news is although it's not a good news to get a high blood pressure at a young age. Yeah, good news is your body is because of the lifestyle, diet, or body weight and things. Your body will be more easier to change. Yeah, for those factors. Yeah, to get it corrected for your blood pressure. Okay. Especially if you're overweight at young age, then it's easier to lose weight than if you are already middle age or like that.
Yeah. So diet, and then again exercise, and everything else is the crucial factor at a young age to try and improve.
True.
Yeah. I mean, lots of people, when I've done this kind of thing before in the past, have said, look, had high blood pressure, actually walked to work, walked back, and got rid of my high blood pressure tablets, or diabetes, very similar. Lots of exercise, and I've just reduced out of the tablets and reduced my weight. That is the key, isn't it, to this?
Yes, these days. Previously, when we know about diabetes, we thought it's not actually reversible in a way. But now we got more and more evidence that it is. We can make it into remission.
Remission.
Yeah, maybe not reversible, but it's remissions.
So it can go backwards.
You can free of tablets, medications. Like it goes into remission. And it's mainly because of your lifestyle, and definitely because of your weight loss. If in the first place you got the diabetes because of your high body weight, then yes, losing weight can actually make that into remission.
Yeah, excellent.
Yeah.
We're running out of time here today. This is Radio Ramadan on 87.7 FM. You're listening to Zuffar Haq on the Health and Wellbeing Show, and we're joined by our guest, Dr. Tan. Thank you very much for coming in, Dr. Tan.
Pleasure.
Finally, we just wanted to mention very quickly cancers. Lots of screening being done for breast cancer, for colon cancer, for bowel cancer, lots of other things as well. If you get those invites, please, it's really important that people go in and get them checked.
Yes, Zuffar. It's like I can't tense enough. I can't urge enough more than that. Actually, that's very, very important at the moment, and we are seeing that unfortunately in our ethnic minority population, the uptake for screening program for cancers has been gone down. So we really want to urge actually for take on those kind of cervical screening programs and bowel cancer screening programs effectively. Yeah.
Thank you. Thank you very much. You're listening to Radio Ramadan on 87.7 FM. I'm your host,